So, what's stopping people to go to the hospital? Or most importantly right now, vaccination center. We are all afraid of not being able to go outside, and even worse, unable to see our friends physically, ever. We all fear something, but they got phobia. The word phobia gets thrown around a lot in conversation. But how well do we really understand them and the effect they have?
There are over 400 officially recognized phobia. The real definition of phobia is a type of anxiety disorder that causes an individual to experience extreme, irrational fear about a situation, living creature, place, or object. However, phobias are diagnosable mental disorders. Despite how bad they feel, fear and anxiety are natural emotional responses to a real or perceived threat. If a person has a fear of spiders, for example, they may go to tremendous measure to avoid them, and their fear may affect how they live. The cause of phobia may be the past incidents or traumas, learned responses from early life, strong reactions and responses to panic or fear, and experiencing long-term stress.
Most hospitals right now are majorly filled to the brim, with dangers of COVID-19 still around us. Sure enough, this is the case for claustrophobia.
Claustrophobia is the fear of confined space. People who suffer from claustrophobia have intense fear of small spaces and think there is no way for them to escape. Dr. Vitton explained that claustrophobia happens due to the imbalance of transmitters in the brain. The panic center in the brain goes off even when there is nothing to be panicked about. The person feels dizzy, shaky, lose control, and feel that death is close. The geriatric and psychiatric mental health nurse practitioner from New York, Dr. Timothy Jalek, stated that claustrophobic individuals are possibly having a smaller amygdala. Amygdala is a part of the brain that controls the body to process fear and is associated with stress responses. The suffering patient may also face childhood experience where they might have been in small spaces, airplanes, or getting bullied when they are young. Once they are an adult, the past haunts them, which makes them unable to function properly.
Now, ask yourself this. When are we most exposed to blood? An injury? Accident? Ever consider the hospitals? This is what we call the case for hemophobia.
Hemophobia is an abnormal and persistent fear of blood where intense dread of seeing blood or receiving tests or injections that may include blood. It is classified as a specific phobia with a particular blood injection injury (PII) phobia. Those who have experienced a catastrophic accident or sickness that result in a significant blood loss may be at higher risk of developing the condition. Hemophobia is an anxiety-like reaction to seeing one's own blood. There are several factors and causes that lead to hemophobia. The first one is genetics, where there might be a hereditary relationship or it could be naturally sensitive and emotional. Overprotective caregivers or parents can also lead to anxiousness that is more widespread. This may be because they were over-reliant and overprotective parent or caregiver as a child. Lastly, a trauma. A fear might develop as a result of stressful or traumatic circumstances when it comes to blood. Sufferers of blood transfusion syndrome may experience both physical and emotional symptoms. They may experience breathing trouble, rapid heart rate, chest tightness or pain, trembling or shaky, dizziness or lightheadedness, feeling nauseous in the presence of blood or injury.
Not accounting any masochists out there, most of us hate pain. Heck, some of them have an excessive fear of it. And that's algophobia. COVID-19 being one of the diseases with the most excruciating symptoms in its final stage. There's logic in this fear.
According to research done by Laura A. Leach, algophobia is an abnormal and persistent fear of pain. The fear is excessive beyond that which is expected under the circumstances, producing an anxiety reaction. The symptoms of algophobia are very similar to other specific phobias and will often include cold shivers, panic attacks, loss of consciousness, and temporary paralysis, insomnia, or ill could simply be avoiding hospitals appointment or to meet the dentist. Those who are excessively afraid of pain tend to predict and exaggerate the amount of pain they may feel. In an attempt to reduce the chance of suffering, the extreme measures taken may contribute to avoidance behavior. Unfortunately, for the sufferer, these safety behaviors reinforce the phobia rather than solve it. Algophobia may have become worse over time as more and more sophisticated safety behaviors and routines are developed.
I'm sure you all can guess it by now. One of the few reasons the people of Malaysia backing away from vaccination appointment. And that's trypanophobia.
This phobia has become an increasingly relevant issue in medicine. Trypanophobia is an extreme fear of medical procedures involving injections or hypodermic needles. It is especially common among children due to the unknown of getting pricked through the flesh. There are many types of trypanophobia experienced by the person. The most common one is vasovagal, where it involves a reflex reaction in which they see, feel, and think about the needle. A chlamydia paralysis, pallor, nausea, respiratory abnormalities, and varying levels of unresponsiveness are only some of the autonomic symptoms that might occur. Associative originates from watching or experiencing such as traumatic painful medical treatment. Resistive are those who have been restrained or bridled. It arises as a result of bad management or previous experiences of being physically and emotionally pressured.
As mentioned before, it is a treatable illness. It is not permanent.
There are a few treatments that can be done throughout this phobia. Systematic desensitization will help the patient learn cognitive methods such as stop technique to stop, think, observe, plan, where it will change both behaviors and feelings of fear when having claustrophobic situations. Applied tension therapy may assist in the treatment of hemophobia's fainting symptoms. The objective is to tighten muscle in your arms, chest, and legs at specified intervals until your face flushes when exposed to the trigger, which is blood. Wolverhampton hypnotherapy can provide a variety of psychological treatments for algophobia. For trypanophobia, cognitive behavioral therapy (CBT), discovering strategies to cope with the fear of needles is examined during treatment sessions. The therapist will assist by gaining a better understanding of those worries and how it plays into effect. There are also a few tips that you can practice in the absence of professional help, which is talk to someone you trust, learn to manage panic and anxiety, look into support groups, and use self-help resources.
The better one knows their phobia, the easier it is to cope, or perhaps overcome it. By understanding the source of patients' worry and anxiety may aid in better patients' management and treatment. Fear should not be a chain. Even today, we can still see people fighting their fear for the good of all. And for those of you who don't relate with this fear, please check out the people you know. Herd immunity is our responsibility. Nobody's safe alone. Cheers.